Okay. Call the meeting of the HR committee open, and I'll ask Madam Secretary to take roll.
Director Curry.
Present.
Director Robinson. Director Sorrell is absent. Chair Garza.
Present.
And for the record, those directors also present. Director Bott.
Present.
Director Deere stepped around the corner. Thank you. Director Harrington.
Present.
Director Story. Sorry. Go down the line. I'm sorry.
Good morning, President.
Thank you. And Board Chair Taylor.
Present.
You have a quorum.
I'd say so. I mean, it's nice to have so many board members as guests for this committee. Okay, so the Human Resources Committee's regular meeting schedule for 2024 has not yet been determined. However, it is expected that the committee will begin holding their quarterly meetings starting in February of 2024. Are there any members that are remotely connected in? If so, we'll need to have a motion to allow them to participate.
We do not have any remotely connected.
Thank you, Madam Secretary. So I'd like to entertain, oh, sorry, we don't have any. Is there anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
Yes, we have two registered speakers. The first is Cherie Cordero. And as a reminder, speakers have 3 minutes, and I'll give you a heads up when you have 30 seconds left.
Good morning.
Good morning.
Good morning.
Thank you for allowing us to be here today. My name is Cherie Cordero. I'm a trauma nurse here in Cook County. I've been here in trauma for 28 years. I'm a proud union member of the National Nurses United National Nurses Organization Committee, and I've actually been a nurse for 39 years. Right now we're here because we feel HR has failed us, the nursing team, and therefore it's causing failure for patients, the community, and even the taxpayers. We have the nurses, we've had them apply numerous times for posted positions. Many have gone to hiring fairs that are held by the Cook County Health System, and many still remain unemployed at Cook County, and they remain disconnected, and the staff nurses, they remain disappointed. We brought a plan to HR of how to attract qualified nurses for our special needs population, and we also informed HR how to reward those loyal and dedicated nurses that were agency by hiring them. These nurses were already vetted in our system. They had proven not to fail our patients. They had not failed our community, and they had shared our mission as a hospital healthcare organization. The agency nurses collectively have helped us get our patients through that horrible pandemic, and they are still working along with us now, taking care of patients that are suffering from numerous disease complications and healthcare disparities. Also, they have been partaking in training of our new hires, most of which are new graduates. Here again, we feel HR failed us by using agency personnel to hire nurses. We don't know why they chose to do that. HR failed nurse retention by not advocating for extra shift bonuses. Most other hospitals used extra shift bonuses to retain the staff they had at the very start of the pandemic and never went into this fury with all the agency hiring that we've had to go through. BHR also agreed in April to negotiate extra shift bonuses. We've sent numerous proposals, and management has not had any answers for us on that.
Pardon me, interruption. You've got 30 seconds left.
HR agreed with management and hired new grads as replacement for seasoned nurses. While HR and management insist this was not their intention, they didn't work diligently to prevent it, and patients, and they've had no choice but like us to make it work. New grads are always welcome, but they do take time to develop, and that's done so that we don't have an increased risk for the patient or increased vulnerabilities on anybody's part.
3 minutes has
thank
elapsed.
you.
Thank you.
Thank you.
The next speaker is Tina Montanez, who is going to be reading a statement from Genevieve Lewis, who was unable to be here.
Good morning, and
Good morning.
thank you very much for your time. My name is Tina Montanez, and I'm reading this in behalf.
Can you speak a little bit into the mic, please?
Sure. Is that better?
Just lean in just a little bit more. I'm sure.
Okay. My name is Tina. I'm one of the nurses here. I'm speaking in behalf of Genevieve Lewis. She wrote this, but was unable to attend today. And she wrote, "Nurses are struggling. We are constantly overworked, short-staffed, and pitted against non-union nurses when it comes to scheduling, overtime, and requesting time off. In large part due to hundreds of vacant staff nurse positions throughout county and for many years now. It is not okay. We deserve better. We need HR to be responsive and timely to our information request. Grievance disputes and labor relations meetings when trying to resolve issues and problems we are facing in our units with hostile managers that abuse their authority. We kindly request this committee urge HR to do better to ensure a smooth and efficient hiring process, both internally and externally, to help bring desperately needed nurses to our units so that we can make Cook County Hospital a great and fulfilling experience for the families seeking care here. We work too hard to not be heard or ignored. We urge you to consider these concerns and cooperate with us so we can work together in making all our lives better and successful for the sake and well-being of the diverse communities employed at Cook County, and especially for those communities we provide quality and necessary care for. Thank you. This was from Genevieve Lewis. Thank you.
Thank you both for your testimony. So we will go to item 3 on the agenda, which is the report from the Interim Chief Human Resources Officer, Carrie Primmick-Boak.
Good morning, everybody.
Good morning, Carrie.
Okay, we'll go through our metrics first this morning, and as you can see, we've had increases in our total positions filled. We've increased to just under 1,300, with over 1,700 offers having gone out year to date as of October 30th. That's we hope by the end of this quarter, which will be another month's worth of data, to be on par with last quarter, which saw a pretty good increase. And then year over year, we are definitely seeing those numbers trending upward with bringing in our new hires, especially the external new hires, and really decreasing that gap with our vacancy fills. So we have to date, well, not to date, as of October 30th, brought in just under 800 individuals externally. So our net new is increasing significantly, and we intend to keep that up. We also, as you can see, trended slightly upward on our time to fill. Our goal is 90 days. We trended upwards of 96. When we dove into that data a little bit, what we found was there's been a lot of data reconciliation happening as we transition into a new portal for tracking and providing accurate real-time metrics for both the hiring managers and leadership. And we also identified that there were very few positions that were skewing the data because of the lengthy time to fill on those roles, which tended to be those physician and advanced practice roles that were very difficult to fill. And so several of them had very lengthy time to fill numbers associated with them, and that skewed our data upwards again on our time to fill. So we are expecting those numbers to come back down as we continue to clean that data and fill those very difficult roles that were in our system for quite some time. This is our turnover and separations impact summary. So this is data as of November 1st. And as you can see, we're holding fairly steady on our turnover benchmark at 9.1% for fiscal year 23 so far, which is well below the national average. We've been taking a look at the new national average as the data for FY23 is coming in, so we expect to have a good number to report on during the next report. However, right now it seems to be the national benchmark of healthcare turnover seems to be averaging between 19.5% and 22.7%. So at 9.1%, we are well below the national benchmark for turnover. We had approximately 65 separations in this last reporting period, and so we are not nearly at what we were for turnover back in 2021, and we are slightly above 2022. We have one more month, and we do expect our retirement notifications to be coming through, so this number will go up during the next report. What I'd like to spend some time on this morning is our strategic initiatives. The first one we won't spend a lot of time. It is more of an update on our accelerated nursing program, and we are still doing the data analysis on that pilot program that is still continuing today to bring in our nurses and really beef up the staffing on the department level with employed nursing staff. Our goals through this accelerated program was of 150 nurses to be brought in, and we are at currently 135. So we are well on our way to achieving that goal through this pilot program, and we expect the data analytics to show us the success of this program and the impact at the department and patient levels in the coming months. But we've also been working through different types of email campaigns to broaden our talent pool, to get those qualified applicants to choose us to apply to so that we can select them to work with our team and enhance our team. We've had a targeted email campaign in the surrounding states, so not just for Illinois, not just for Cook County area, but Wisconsin, Iowa, and Indiana. And the targeted positions are really hard to fill, as well as large vacancy areas. So our medical assistants, our nurses, our rehabilitation teams, our physical therapy positions, as well as our respiratory technologists. That's where we've been really focusing our target. Yes.
I have a question in that regard. So first and foremost, thank you for the outreach that you're doing. As it relates to the email campaigns, and I know that we're looking at individuals in surrounding states. As it relates to those that are here, what email listservs are you using? Like, what groups are you targeting? Are you working with city colleges, graduates of city colleges? Are you getting a list of those from the licensed professional organizations? How is that working?
So we are working with schools, nursing schools specifically, universities, as well as nursing associations, our professional healthcare associations, as well as targeting our own candidate pools, historical and current, and utilizing that Taleo aspect of it. And then, of course, using social media outreach as well to enhance the email campaigns.
And so all of that's going through email, though? You're getting emails from the nurses associations, et cetera?
So we are pushing it out to them, and then they are pushing it out to their,
I see.
their memberships, yes.
Thank you.
Mm-hmm.
Carrie?
Yes.
I have would you mind, I should know this, I just don't recall. Would you mind just reviewing at a high level the Nursing Accelerated Program?
Sure.
Have some of the functions and the role that Dr. Peters and her team plays in this process?
Sure. So so we start with a collaboration with the nursing leadership and the nursing team specifically to identify those roles where they have the largest number of vacancies and where we can impact the most patients quickly. They are entry-level nursing positions in targeted areas, for instance, our trauma team, our med-surg teams, where new grads can apply to those roles. And our process is a quick turnaround posting process where we will post for a period of time, a shorter period of time than the 14 days that is usually prescribed after we've done our internal CBA required processes. And then as those applicants come in, we will actually begin reviewing them right away, and then HR will determine whether they meet those minimum qualifications, which are pretty minimum for these roles. And if a candidate meets minimum qualifications, we will immediately call and contact them to, one, identify that they are still interested, as well as whether they will accept the offer for the position. So we really have, with the collaboration of the nursing team, cut out the interviewing in-person process, and it's more of an HR call, discussion, and offer immediately process. And that way we have a turnaround time that happens in a matter of days to a week as opposed to multiple weeks or a month.
So the discussion is held online, the interview, if you will.
Yes, they are constant as we are going through the applicants for the positions that they posted. And then once we've exhausted that applicant pool for that particular posting and advertisement, then we will repost if we still have additional vacancies for that type of a position to fill, and we'll start that process all over again.
I'm just curious, just a quick follow-up, Carrie. About 6 or 7 months ago, the paper mill, the nursing factory out of Florida, the 3 schools that were involved in the scam.
Mm-hmm.
How do we protect our institution, from those individuals who have these fake or licensed degrees, et cetera,
Well, we always do a PSV, so we have to get primary source verification of their education as well as their licensure. So they all have to be licensed. We do not hire our nurses to come without a license. So they've at least been vetted through that state process, and we confirm that they have met that vetting and are licensed, as well as do that primary source verification with their educational institutions. And so as long as, and we have a few organizations that we work with to ensure that they are accredited institutions where their degrees are coming from.
So
but now our entry-level nurses aren't necessarily required to have a bachelor's either, so they are associate-level programming.
Right.
Mm-hmm.
But they have to be licensed in the state of Illinois.
They
through the Illinois Department of Financial and Professional Regulations.
Yes,
Yeah.
So you get that from the state
we do.
as the first step.
As the first step, before we make a phone
verification.
call, absolutely.
I just find it, well, I'm glad to hear that. It was just shameful that so many of these individuals were able to work, not in our state per se, but I know throughout the country.
Yes.
So I'm glad to hear that, we have this triple redundancy almost built in.
Yes.
Thank you.
Mm-hmm.
So, go ahead.
Thank you. Carrie, I'm curious, as I listened to the person who presented some testimony early on, there seemed to be some suggestions or other things that were spoken to that were offered to nursing management by way of enhancing recruitment and getting some better stats for bringing people on, that she said quite directly that she felt weren't listened to or weren't being considered. And I'm not getting into that, but I would like to know if there are any things top of mind that you feel that have been put on the table or discussed that, in your estimation, would have improved or increased some of the recruiting efforts that, for whatever reason, were not considered. I'm looking at the decline rate here at 32%, which may be average now. I don't know where to put it, what context. But are there other things that you felt that may have been discussed or put on the table that needed to be considered?
You know, I'm trying to think through all of the different proposals we've had. We are constantly working with NNOC and their membership to discuss programming and recruitment, and whenever we make changes, we work with our labor team to facilitate those impact bargaining. And I can't think of any outright that have been just rejected. And I'm sure, and I know some of them, as she was talking, some of them are still on the table for consideration and discussion. So although without getting into the details, since they're still open and on the table, you know, we definitely take seriously all recommendations that they provide to us, and we have a lot of meetings and discussions with them to work through what we are doing and how we can improve that and what suggestions they have for that.
And that does, also include consideration of, there was reference to these shift bonuses. I thought that we've had, implemented some programs that regard, or?
So they are referring to a very specific extra shift bonus proposal that's on the table at the moment.
That's on it, okay.
Absolutely. But you're right, their collective bargaining agreement, they have other bonuses or differentials, actually not bonuses, but differentials that are already incorporated, and this is in addition to those.
In addition.
Yeah.
Thank you.
Mm-hmm.
The question that I have is, I know, and this is probably a longer conversation, but I want to put it on the table just for percolation's sake. And that is, you know, we're doing all of this outreach as it relates to trying to attempt to get people to come over to Cook County Health. Are we considering pipeline opportunities with schools and reaching out to schools before people even make the decision about the career and try to get them into the pipeline? Are we thinking about doing something in that area?
Yeah, so we have our workforce development team working with the nursing leadership team because they have their residency program. We're developing programs with schools to do their rotations and clinicals on site. And then, of course, doing that outreach to the high school and collegiate levels as they're doing their career selections process. And we've attended a few of those career fairs as well. And we are going to continue to do that, absolutely.
All right, thank you.
Chair, I'm sorry, can we have Dr. Peters to come up to the mic, please?
Sure. Yes.
Good morning.
Good morning.
Good morning.
Yes, we are doing number of initiatives to build the pipeline. In June, we met with the 18 College of Nursing across the Midwest, and the goal was to increase our student placement. And part of that, we expanded our nursing student placement across the system. Now we have students at the ambulatory, Provident, as well as correction. Those initiatives actually increased our placement by 170% for this fall. So we are really working with all the College of Nursing to really increase the pipeline. We also have a student externship program where we are hiring the nursing students in their final year, the third and fourth year, with the intention for us to be part of hiring them as they finish. So we had the first graduation 3 months ago, and all of them are choosing to come here. So there are a number of initiatives we are working in collaboration with HR. Just wanted to, Carrie and come together on that piece. So
do you have stats on that? Do you have any statistics on that? The number of people that are coming, can we see that? Can we get that at some point?
Yes, happy to do that, the whole program, and we are doing. And some of the challenges faced by the College of Nursing across the system, also not having enough faculties. We have number of nurses, masters, and doctorally prepared here, which we pay for the education. So we are also working and exploring the option to have a collaborative faculty agreement so they can also get the support from us. So happy to present that.
I appreciate it. Thank you.
So just a quick follow-up, you have on your staff, advanced practice nurses, PhD candidates, and you're offering that support to the nursing programs in the community to affiliate with?
We are exploring that because we need to figure out those strategies. How can a Cook County health nurse go and get an appointment at the hospital? But that is part of it. We have a number of APRNs as well as doctorally prepared nurses in our system.
Thank you.
I'm not sure which one of you, or maybe both, would be able to address the question that I'm asking. But, the testimony previously, they mentioned to some things that I think we've addressed in the past. And, the idea of hiring, and we're looking for some of the people with registry, some of the other more senior people. Can you speak to some of the initiatives that you have stated in the past? Because, Chair, I think it's important when we have someone who comes to give a public testimony that we present both sides and not let it be skewed one way, because we've asked these questions many times, and we hear different people coming, making statements without any substantial proof.
Right.
And I think this is a public testimony, we should be able to hear both sides. So please, if you would, either one of you, just speak to the initiatives with hiring that you've done with, offering opportunities to the, registry and the other people, and how you give employment opportunities first to those people who are here that are seasoned to be able to take positions. If you can speak to that, I'd appreciate it.
I will get started. Yes, our goal for the last 12 months, our goal is to really transition our own agency nurses to be part of the staff. And because everything what that mentioned in the public testimony, they are used to our system. So what we have done is, I personally send an email and a communication to all the registry nurses, inviting them to apply. We also post the open house information publicly to all of them. And I personally do the rounds, and part of the rounds I engage and ask them to be part of the team. So there's a lot of, the marketing and communication is really encouraging our own agency nurses to apply. So we just need to really look at some of the process and see what they mean by. I'm also going to ask that whether we can put a report on the number of agency nurses we transition from agency to our staff. But our goal is, we share the same goal. Let's bring and onboard all our agency nurses. So that is the common goal. So we need to just understand the gaps, if any.
Yes, and to get to your, the preamble to that answer for your question of what are we doing with our internal staff, they do have their own process that does not integrate them with the external, so that they are viewed initially, first and foremost, for any positions with promotional opportunities for them.
I'm sorry, just so you can say it clearly, so they are receiving it initially and prior to others being given an opportunity?
Yes.
Okay.
Yeah. So that's for both promotional opportunities as well as even lateral transfers. So someone who might want to go from clinic to hospital, hospital to clinic, or specialty, corrections, public health. We have lateral transfer programs as well, and so all of those vacancies are offered to the internal union members first.
And I'll just offer that I spent some time speaking with Carrie yesterday about this issue, and I'm very confident that this is not a lack of competency or commitment. Let's pull it back for a minute and look at the macro situation. There's a shortage out there, and I sit on another hospital's policy board, and they're going through the same thing. Now, we both agree that we still have to figure it out, and I think that's what you're hearing in this report. Right. We're trying to figure it out, and their commitment's there to do that. So I'm confident as the chair of the committee that that's what's happening.
And I'm sorry, I was just going to add one thing to answer your question, Director, to make sure that everyone's aware, because you want to really showcase the work that has been done to be able to retain. And so part of the things that we've talked about, but just to make sure that we remember in the work that has been done, we did do retention bonuses that have been given to each of our employees, and I think we've had well over 2,000 of our employees take those retention bonuses, which gave them additional payment for staying on. We did have COVID payments that were given to employees throughout the time when we were having some of the difficulty in payments that were given to individuals. We have extended our leaves program now that we have full leave for both parents who are going to be having childbirth event, which is an extension. We have looked at making sure and working to increase with the county our inflation adjustment rates to be at market, and even done it retroly. So there have been additional payments recently to individuals who have gotten those payments to make sure that we are keeping pace in what we continue to look at. We continue to invest in our full tuition reimbursement program for individuals all the way up to their doctorate, which is the most competitive of almost anybody in the market and what we can do. We continue to retain our pension, and we continue to make sure we have affordable prices on our negotiations with unions for healthcare. And then on top of that, we continue to look at how we can have balanced hours and what we can do to make sure that we're moving it forward. On hiring, we used to require BSNs. We broadened the pool to associates. We've opened job descriptions. We've done streamlining. And because we want to maintain our CBA agreements, we don't, there's certain things we can't do, like other hospitals said, you can't create an internal agency. But what we did do was to take some of the processes with the way that we hire an agency to be fair to our staff. There was a question, well, if you can bring an agency expedited and you just look at them and then they get started, why can't we do that with employees so you have that benefit? And that's really the accelerated hiring you heard. Now we have an accelerated way, the way we would bring in a union member to come work with us. We check their background, we check their information, we check that they're qualified, we work with them, we train them, and then we have a 90-day probationary period that they can evaluate. And that means that now if someone wants to come in through agency or come in to be a permanent staff member, they have the same expedited resources. And then we have, of course, done substantial investments in modernizing our technology, shortening down the time to hire, and then bringing in Deloitte and Slalom, which the board has approved and been supportive of, to make sure that we have completely renovated the ease of posting. And so there's still more that we can continue to do. And I know that one of the biggest things that we have been negotiating with downtown that both the board and the Board of Commissioners have approved there was a three-legged stool to sort of do that retention. One was to immediately do retention bonuses, which we have done and negotiated. And then there was to be able to do sign-on bonuses, which we've also done, is to create sign-on bonuses so we're competitive. The last one was to pay shift differential bonuses when we needed some, to have sort of a competitive internal agency rate for individuals taking additional shifts that were pre-scheduled. And that's the last part that's being negotiated, but quite a bit, and even more has been done. So, and then on the salary compensation package, just the raises and things that were negotiated in our CBA have really put us in a position to be competitive to market. But, you know, we can always do better, and we're looking to do that, but we have not been waiting. There has been a lot of work that has been done, and still more will continue. And I know that from the staff perspective, we're very thankful for the support that this board has given us to be able to make those things happen.
Thank you all for that, and I think I've asked the question before, whenever we hear certain testimonies that are being given, if there's a way to maybe communicate this information and get it all the way down to the lowest levels so that morale will not become, I guess, disillusioned with the fact, with the thought of you're not doing anything, when we look at the numbers, and the numbers tell typically 60 to 80% of the story, that you're really doing the job. And so if we could just try to communicate that, because we want everyone to be moving in the same direction. And you guys are, from everything we've seen, doing a really fantastic job in human resources as well as with the nursing. And I think it's important for us to put that on the record, because these things are stated as factual versus hearsay.
Yeah, I'd like to.
Yeah, go ahead.
Yeah, I just want to make a few comments. And the first one is the problem we're talking about is not unique to Cook County Health.
That's right.
It's a national problem.
That's right.
And we're doing the best we can in difficult times in terms of hiring staff, not only nurses, but other professionals as well. So we've seen that, and that's why we have a lot of contracts out there and contractors that are helping us with recruitment to bring people in. So the problem is not a local problem. It's not specific to Cook County Health. It's a national problem, and I think we're doing the best we can under difficult circumstances. So I want to applaud you for what you're doing, and want people to think about that as we move forward, that this is not a unique problem that we have. It's a national problem. The other thing, and I'm encouraged because one of the first things that was pointed out is our turnover. And we don't have a lot of turnover. So that implies, and is lower than the national benchmark, so it implies that this is a good place to work. So it should be attractive to people to come here and work, because people that come here typically stay here for long periods of time. But we will continue to do what we can to get our staffing levels to the point we'd like to, and we'd all like to see.
Let me just add that, Joe, thanks for the, comment. As it relates to your first comment, we've talked, comprehensively about how it's a national problem, but let me reassure the board and others that Carrie's not satisfied with recognizing it just as a national problem. She wants to fix this thing with her team, and the commitment's there to do that. So, go ahead, Carrie. Thank you.
Mr. Chair?
With that being said, Terry, what is it, with that being said that our chair just mentioned, how can we better support you and what you're trying to do?
You guys have been giving HR and the whole system a lot of support to help our recruitment and retention and our employee engagement and relations efforts, which will be in some of the future slides I talk about today, and how we're utilizing the assistance you guys have already given us. So I would just say definitely keep giving that assistance and support that you have been giving. We are working to, as you are well aware, fill in some leadership gaps in the HR team. And I know once we can get those in place, we will propel us even faster through a lot of the changes that have been taking place over the last few years, and continue to improve all of these efforts, whether it's on the recruitment side, the retention side, even the retirement and exit side, so that it's a full and comprehensive, good experience for the employee from application all the way through their full 33 and a third year retirement time frame.
So I want to commit to work with you on helping to figure this out. So I'll get on your calendar, and I want to learn first what you're doing, and then kind of lend some of my experience to kind of help us figure this out. I think if all of us put our heads together, we can create some solutions. I think, there's no problem that it exists that the solution wasn't already there before the problem got there. So the solution is there. We just need to all figure it out.
Absolutely. We have to make it work for us.
Indeed.
I echo the comments made by my esteemed directors. They've got to most of what I was going to get to, and then I was going to ask about retention with Israel covered. One of the other things I might suggest, you may have already done this, is of the 135 offers accepted, are there any common characteristics within that group that we might learn from in terms of who are the folks that are accepting and coming on board? And then on the referral bonus side, I think we've talked about that in the past, but this is just some other considerations.
No, absolutely. And we are constantly looking for those threads and themes that are working for us and capitalizing on them. And so that's where that constant data analysis and especially in this pilot accelerated nursing hiring program is going to benefit us. And so we are definitely looking at those questions specifically.
Appreciate the work of the team. Thank you.
Okay. So the next slide takes us through and introduces, for essentially the first time publicly, what we've been building for the last year and a half for all of our employees, which is improving our development programming. And so we're calling it the CCH Learning Institute, and it is a full learning program that is supposed to empower our staff and our leadership to learn, grow, and drive the results and fulfill our mission. And in doing all of those things, make sure they're doing it with purpose, support, and passion. So we've broken it up into 4 basic goals of having this learning institute. One is clinical and professional learning. So that would be certification trainings and programs, competency trainings and upskilling programs. We've got residency programs. We've got the nursing residency program. We have an extensive medical residency program, building in and working through rehab and respiratory areas to build in some programs for them as well on their residency and extern and internship programs. And then, of course, the very specific job, clinical and professional training that can be done in-house as opposed to that are more certification-based. We've got workplace learning, so just strengthening and growing our own teams so that they can grow upwards in their career, pathway learning so that they can choose different pathways from wherever they're starting at in our organization, and really tailoring those education and training and management, performance management models to fulfill and getting them that job satisfaction, because the more satisfied they are in their job, the better they are going to be able to serve our patients and get us that quality care and make us that premier institution for not only quality healthcare, but also quality healthcare learning. We've got our leadership development. We can't forget about, once people have moved up into leadership programs, really continuing to develop them out so that they can empower their teams and staff and continue to elevate that quality patient care, quality team building, and quality growth of each individual. And then, of course, we can't get away from our compliance learning aspects, and those regulatory requirements are policy-driven and internal compliance goals. And so that is also a part of this Learning Institute that is handled on an annual basis, and many of you have seen a lot of those modules through your own onboarding and annual education sessions. So the next slide actually gives some examples of some of the programs that we already have in place or are in pilot in the organization so that we can continue to build on them. So on that clinical and professional learning, we've got an EMT apprenticeship program that is looking to roll out in March of 24, but it is part of a grant-funded program that we are working with Department of Labor on as well. And our workforce development team is using community organizations and resources to help us bridge in getting individuals EMT certified so that they can come into our organization as EMTs at both the correctional facility as well as our hospitals. And we are really looking forward to seeing the impact that that has on our recruitment and our retention, as well as culling from our community those individuals who can really help us excel as an organization.
I'm sorry, can I ask a question? With the EMT, what type of person is qualified to become an EMT?
So they have to have a high school education, and then they have to go through a training program through different certified organizations or schools. It's not quite, it's not a degreed program, it is a certification program, and they end up getting their EMT paramedic license or their EMT basic license. And so either one of those we accept in those organizations.
Time-wise, approximately how long does it take?
This particular program, I'm not sure, but I believe it's a 6 to 8 weeks, depending.
Okay, so let me ask, and there's a need in this area?
There is, yes.
Okay, so let me ask a question, and maybe this question is not directed towards you, but you helped me get here. 6 weeks is a very small amount of time. Can this be utilized to help inside of our population that people are looking for jobs and they say they can't find it? Can we actively recruit inside of the different minority communities to get people good, solid jobs where they can contribute to our society? Because 6 weeks, man, that's quicker than anything I can think of.
There's actually an outfit doing that now. I know over in Lawndale, the outfit Superior, their whole class is there for people in the community all the time. I think they got a class of 20 going on right now, and they are recruiting in those local high schools because obviously they have a labor shortage as well. So I know that they're doing it. I don't know if any other outfits are doing it, but I know what's happening in the community where I live.
So we do have a few programs that we have underway and are moving in process. However, now that we had to do a few things first to really be able to ramp it up, and we have a few things coming forward that will expedite where you want it to go. We had some challenges because as a governmental entity and how we hire and how we do that, we have to do things so the open jobs fair could be created in conjunction with schools who are graduating, and people could be able to apply for positions that we have open. It's how we get them in. But creating the pipeline, we have been working with Malcolm X. We have been working with Ms. Peters created a full program where we had 18 schools come and talk about how we could create those programs. And we had the first one this year. And so we now have components with 18 of those schools that we're having placements here. The Malcolm X program is working with not just us, but a few other of the hospitals in the medical district to see where you need these areas where we could get great paying jobs to individuals in these areas. And so we have been able to do that to start that process getting forward. Internally, we need to make sure we have 2 positions that we have approved that just get hired, is a chief learning officer, which has been a priority that we need to onboard and hire that sits with the HR department, and that will be their job, is to create these structures, create these longitudinal partnerships, and create the initiatives that work there, and also a volunteer coordinator, because sometimes these individuals will have to come in. Anyone who touches a patient or gets seen at a hospital or even for training has to have certain onboarding, and that needs to work. So those two will work together, and I know that job is posted, and we'll start interviewing very soon. And then we have been talking to organizations throughout the country who are willing even to pay for those individuals to work with a university and get training, because sometimes 6 weeks is an insurmountable task if you ask someone who they're the family bread earner and they're the ones supporting their sister, their brother, their family. It's hard to get them to go, even if the school's free, that they have to stop earning money to go full-time for 6 weeks. So there are now organizations, and we've talked to Google and other organizations that may be willing to work with a community college to pay them the salary for the 6 weeks to get those training programs, since they will have such a huge change in their life. So those are some of the programs that we have ongoing. But, you know, some of this great work, because we're so busy as an institution, can get lost if we don't have an anchor. The two anchors to really make those things move forward, along with our equity office, who's been working on that, is to make sure that the chief learning officer and the volunteer coordinator positions get hired, and then they can really start to ramp up those connections with our institutions and our leaders.
Okay, and maybe, yeah, that sounds great. I just would like to see if we can do it, because if we have such a huge need and we have this opportunity, it just seems to be a derelict of duty of all of us if we cannot make this happen, because it's too easy from the standpoint of the need, and there are pieces there. And now that you're telling me the third leg of actually being able to give someone a salary of some sort to be able to help bridge that gap, it just doesn't make sense if we don't make it happen versus talk about it and think about it, but actually make it happen.
Yeah, absolutely. And so we'll definitely, there were priorities, and then there will be priorities for those positions and how we get onboarded and move forward. And I know that.
And since we have the equity officer, so then we will reach out to all the communities to make sure we don't leave any community behind, because there's been enough that's left communities behind. Now we get a chance to try to right the ship. And it's a big ship, so it's going to take forever to make that turn, but we got to start it somewhere.
And then also, I know Dr. McInnes was talking about a school program that we could create, and we'll be continuing that work as well.
Very specifically to your point, though, that EMT apprenticeship program is designed, and the grant that was given for that is to do exactly what you're asking. And so that program specifically that we are working through and rolling out is a community engagement program to bring in people who are not trained yet in the workforce, get them into these careers, and then hopefully bring them on board with our vacancies, connecting them to a hiring fair once we know their graduation is happening, so that we can bring them in quickly.
What's the timeline on that?
So we're rolling out the first cohort March 2024, March of 2024.
March 2024.
Yeah.
For 3 months,
Mhm.
first quarter.
Yep.
I love it. Thank you. I look forward to further updates.
Okay, so you have the examples up there. If you have any questions about any of these programs, I know I would love to bring our Director of Organization and Workforce Development to talk about any of these programs that she's been working to get on track. Leadership development in 2024, we are going to be rolling out our new leadership development program. We've just reviewed and updated our leadership competencies to feed this program. And again, it's to involve the leadership in an entire holistic view of their job, upskilling them, making sure they also have the skills of any positions, leadership type positions that would fall under them as well, and then being able to develop their style and their approach to working with their staff and developing their teams as well. So it's a full comprehensive development program for leadership specifically. Any questions about those?
Good job.
Thank you. All right, the last slide is about our technology roadmap. You know, we've been talking about those efficiencies and making sure that we are reducing everything from that time to fill to the impact of separations from the organization. And automation really is one of those efficient and hopefully eventually cost-effective ways of supplementing that staffing component in HR to make sure these things are running, that all of these programs are running smoothly. So these are some of the programs that we have been building and rolled out over the last 12 months, making the lives of our staff simpler, but then on the flip side of that, making the applicant, candidate, and employee experience that much better as well. And so that they have that satisfaction when they walk away that they were heard, they were answered, and that they have something to walk away with. So we've got our centralizing all our HR data. That is going to be rolling out in the next couple of weeks. They have been, which is one of those feeders into all of the metrics and data that we're providing to you and to the leadership staff as well as the frontline staff about how things are moving in the organization from hire to fire or separation. Sorry, wrong word, hire to separation. And so when we roll live with that, we're going to be taking what used to be a lot of individual manual processes and tracking mechanisms and incorporating them into one automated source. And so we are very happy and excited to roll that out and see how efficient that will make our processes, especially for the applicant and candidate and hiring managers. Those are the three that will be impacted probably the most by this rollout. Our internet website updates, we are avidly working with both our internal and external vendors to ensure that we are modernizing both of those looks, making them simpler to utilize and get that information and communication out to the public and to the staff quickly. Position status app, that is for our hiring managers and our leadership specifically, and that is going to roll out in the next several weeks as well once we transition into our centralized HR data app that's rolling out first. And that will give real-time information to the hiring managers about the status of any position that they are trying to fill so that they know where it's at, how long it's been there, and what that next step will be in the process to move it forward. And then they will have data that they can bring back to their HR business partners, to their leadership, to their recruitment team to get information on how to either move it faster or to simply push it over that finish line. And then we are, in the next couple of months, working with our HIS team and with our strategy team to look at all of those AI technology enhancements that we might be able to utilize to supplement and then continue to improve all of our HR processes. And
Excuse me, Karen,
sure.
I can't read. The AI technology is there. Can you just enunciate, just tell us what that is out loud, please?
Sure, the AI technology roadmap. So that is to help us empower and we are making it larger, empower the CCH to solve our larger, more complex problems, our recruitment operations, leveraging artificial intelligence to communicate and have Q&A on our intranet and on the phones for employees and applicants and candidates. One technology solution is in our ability to update any updates we are making to whether it's something as simple as a job description or an organizational structure or communication efforts with somebody to give the staff and management that real-time information and access. So we are working with them on those AI opportunities, some of which we already have some capabilities for and that we just need to develop, and others that we may need to go out and seek.
Are you using the AI to address what Director Bott mentioned earlier, as far as looking at the analytics and finding those common threads to be able to see that AI is a good tool to use in that way?
Not yet, but that is one of our pathways that we are looking into.
Yeah, you've listed 8 different initiatives, and I assume they have different timelines. It would be helpful to know where you are with these and when you expect them to be completed.
Sure. The 8 that are listed here.
Right.
So the offer letter generator is already live, and we're utilizing that already. The centralized all HR data, The first component of that is going to roll out by the last week of November. I believe the 29th is specifically our date for that. The visitor modernization is in the works, and we are hoping for in 1 month to be able to roll out our pilot of the programming that we're using, which is iPads at the front desk for HR to help us track and monitor and then analyze the data that comes in from that, so we can make sure we are staffed and available to the employees who come to HR very readily. Intranet website updates, that's a little bit murkier on the rollout dates and implementation because it's multi-phase and then doesn't just affect HR, but I will try and get you those for the next meeting. And then, let's see, learning video library, the training video library, that's an ongoing project. So we already have some out there. Every time we come up with a new solution or need to reach a very large audience about changes to the HR organization or to other areas of the organization, we create those and put those on our learning management system. So that's an ongoing, and we are already using that as well. Position and status app, we're looking at hopefully before the end of December on that, but that relies on that centralized HR data rollout. And then the virtual hiring assistant and AR, those are in the very early developmental stages.
And you say that, the statement at the bottom, 18,279.5 hours saved in the last 12 months?
Yes.
So that's in terms of what we've been doing with technology, and that's how many man hours have been saved as a result of that?
That is, yes. That 18,000 hours that's listed at the very bottom of the slide of hours saved is with these tech solutions, as the ones that have already rolled out that are listed, as well as the others that we've been telling you about throughout the year, such as some of our new data repositories and our information and document sharing with the compliance offices.
Thank you.
Mm-hmm.
Any other questions or comments?
One last question. I went into your index.
Sure.
And I'm looking at the page 14, and the numbers look really good. And if we flip back over to, I'm sorry, I'm going between quite a few sheets here. Well, okay, this is on 14. You're definitely showing a decrease. You have a negative slope, which is fantastic. Mm-hmm. My question is, would you attribute it to the success in reducing the separations? Is that a result of because now we're on the back end of COVID where we have vaccinations, or would you attribute it to the different efforts that you've placed out to be able to recruit and retain people? Because if we look at your bar graph on page 15, we look at see how we crawled up from 2019, 2020, 21, 22, 22, we hit the apex. So now we're starting to come down. But if we look at 23 and 21, we look like we're dropping and we're doing it faster than we went up. My question is, what do you attribute the success to?
So I would say it's a combination of all of those things, the ending of the pandemic, the people feeling safer being back in the workforce or staying in the workforce, and so they're not exiting as quickly as they were during those early pandemic years, which then, of course, climaxed in 2022. However, I would definitely attribute a lot of this specific retention at CCH to a lot of our endeavors to streamlining and making our hiring processes and recruitment more efficient, expanding our recruitment reach through the use of our sourcing as well as how we handle them once they are in the organization, and then the learning and development programs, the new orientation programs, really those employee engagement efforts that take place from day one of the person accepting their offer all the way through their probationary period, as well as to retaining them, because we initially were seeing a lot of turnover and we were getting anecdotal, unfortunately less data-driven feedback during the exit surveys about just not being able to connect early on. And so when we overhauled the orientation program that with HR, and then even we're working with our departments, nursing had already overhauled and is continuing to improve their extended orientation program, and a lot of the other departments are working towards those same goals so that that connection happens immediately and we can retain them because they feel engaged and connected. It's faster.
I think it's fantastic, which sounds like a very plausible answer to why we see a whole percentage points, increase in the number. So that's fantastic, but the charts tell the story.
They do.
I would also encourage us for the future, a lot of it did help with the sign-on and the retention bonus.
Yeah.
Because that has a program and a component and accountability to staying. So we can build the infrastructure and continue building those programs, but continuing to have programs like that would be essential. And they definitely wind up saving money in the long term. Because we've always said every employee on average can take over $20,000 to improve. So there is an efficiency to keeping that knowledge base, keeping the employees, and being able to reward the tenure and retention that we need, especially until we get on the other side. A lot of these are sins of the past, so we'll keep improving, but I want to give caution that we are a barbell, so we have a lot of young people coming in, amazing, but we have a lot of people who are their 20 to 30 year range, and as those, they've earned their retirement, so we don't want to, but as that starts, there's a lot of knowledge base that needs to be filled in. So even if we get a year or two more of people deciding to say, yeah, I'll do the retention, I'll do this bonus, and it'll help me, they give us a little bit of time to transition. That helps, and so now even more than other times, the retention is an incredibly valuable tool.
Mr. Chairman, I just have,
Yes, sir.
Gary, just two quick questions, not questions, but just a comment.
Okay.
We'd like to ask that you continue to include slide 9, HR technology roadmap,
Okay.
in your report out, and the dates that you gave us today, which you memorialized in, so that when we see this report again, we can look and see what updates.
Absolutely.
Improvements have been made in terms of achieving the desired outcome. One of the things that I'm impressed with, and I'm glad that you have included, is the 18,000 plus hours saved in the last 12 months. Doing a rough math, that's like 9 FTE. So I, once again, compliment you and your team for that effort and sharing that with us. As a board member, I'm greatly appreciative of that number. And talking of work going forward, I hope that you all will continue to do that, like the calendar year or fiscal year 24. If you would just start adding those hours up and just sharing them periodically with the board throughout the year, that's important. That's important. Because we talk about investment. To me, that's a payoff relative to the investment that you and your team have made over the last year.
Yeah, and based upon what you said, if that's 9 FTEs, that's 9 FTEs that we're not paid.
No.
So it's cost savings too.
That's what I said. I'm glad that you decided to share that with us. That's very meaningful. Thank you.
I'm glad that you're taking a lot from that because, yeah, we think that's a very big feat for us that this year we were able to do something like that. And with all these continual improvements in technology automations, we anticipate that will continue to rise.
Thank you.
I would suggest that you make this become a little more prominent, because this
Okay.
is what I would classify as a money slide. This is a justification for the effort. So whenever you're bringing in your consultants or whoever has the knowledge, and now you're transferring that knowledge, this justifies it. And because you're gonna have a lot of folks over here, on one of those other committees, finance committee, that may ask some money questions. This is the answer right here. And it's great for us to know it, but you need to talk to those folks too, because they hold purse strings.
Absolutely.
Okay, are we good? Okay. Carrie, thank you for responding to what was a very intricately and probing Q&A. And thanks for all the work you do. And thanks to my colleagues for asking intricate and probing questions. I think it's a reflection of how concerned the board is about this issue. And Sam, I appreciate what you said about how you have to hear both sides of the story. I think that's certainly true, but I think also we have, not that we're not being sensitive, but we have to be sensitive to the staff, because when they're in the trenches, like the two members that gave testimony, you don't always hear the information because you're in the trenches going through the experience you're going through. So I just think we have to keep that in mind, be sensitive.
And I think Dr. Peters actually addressed that,
Yeah.
when she said, I think you said that you have something like a what do you call it, when, you have like someone from management come and talk to the folks?
For town hall?
Town hall meeting. I think you may mention that at some other previous time to relay information. There are town hall meetings. To answer your question, through Chair, because I think it is most important to make sure we are sensitive to that.
Yeah.
And just wanted to mention, I think Dr. Peters said there are actions that they try to take.
Absolutely. I mean, that's their experience, right? That's what we're hearing about how they're feeling.
And it's most important.
That's right. And where communication can help with that, I've often said that sometimes you have to communicate a message 100 different ways to 100 different people. You know, so, okay.
Mr. Chair,
Yes, sir.
unfortunately, I'm gonna have to leave in 5 minutes. I have an appointment downstairs.
Yes, sir.
I'm hoping I can take a point of personal privilege and give
Of
my
course.
sincere regard to Israel, and reiterate that what I mentioned yesterday, that you will be greatly missed. You have turned this institution around and caused it to not only survive, but to thrive. You will be greatly missed, but we know where you're at. We'll certainly be stopping by to visit. I'm in DC 3 times a year, so you can count on a dinner date. I'll call you in advance. But just want to let you know, I appreciate you, appreciate your personal relationship and professional relationship, and I'm wishing you the very, very best.
Thank you very much.
Thank you.
Thank you, Commissioner. Okay, well, that's a great lead-in for item 4A, which is a proposed resolution in recognition of Israel Lynch Jr., who has served as the Chief Executive Officer. And I'm going to ask Madam Chair, Deb Santana, to read the resolution into the record, please.
Madam Chair?
Okay.
Oh, yeah. Secretary. Sorry about that. I demoted you. Just demoted you, Deb.
Whereas Israel Rocha Jr. joined Cook County Health, CCH, as Chief Executive Officer in December 2020, and whereas Mr. Rocha took the helm of CCH, a storied public health system during the global COVID-19 pandemic, and whereas Mr. Rocha provided exceptional guidance to CCH as the health system responded on the front lines of the pandemic, and whereas Mr. Rocha set an institutional goal to develop a mass community vaccination program to ensure equitable access to COVID-19 vaccinations across the county of Cook. And whereas, as a result, CCH established 6 mass vaccination sites throughout Cook County and expanded access to vaccines at CCH facilities. In all, CCH has administered more than 1 million doses of COVID-19 vaccine, making it one of the first health systems in the country to achieve this milestone. And whereas Mr. Rocha has made health equity and access to care a cornerstone of his tenure at CCH, and whereas Mr. Rocha led the establishment of the Change Institute of Cook County Health. The Change Institute is a change agent and conveyor of internal and external stakeholders designed to address the social risk factors of health and inequitable health outcomes among the most vulnerable populations. And whereas Mr. Rocha has developed and provided executive leadership to a multitude of CCH quality and high reliability organization initiatives to enhance the care and services provided across CCH. And whereas this year Stroger Hospital has received its highest quality scores from Leapfrog and the U.S. Centers for Medicaid and Medicare star ratings, while County Care earned the highest quality rating achieved by any Medicaid plan in the state of Illinois. And whereas Mr. Rocha has been a good fiscal steward of CCH, ensuring that the health system managed its annual budgets with a positive variance and prioritizing the hiring of staff. And whereas Mr. Rocha has uplifted CCH's historic legacy and its mission to provide access to the world's best healthcare and services, regardless of ability to pay, so all may live their healthiest life. And whereas the CCH Board of Directors and the residents of Cook County are grateful to Mr. Rocha for his 3 years of exceptional leadership and service, and now therefore be it resolved that the Cook County Board of Directors does hereby gratefully acknowledge Israel Rocha Jr. for his remarkable contributions to CCH and the health of communities across Cook County.
Thank you, Madam Secretary. At this point, I'd like to entertain a motion to approve item 4A, the proposed resolution in recognition of CEO Israel Rocha Jr.
So moved.
Thank you, Director Story. Thank you, Director Curry. The motion has been made and seconded. Is there any further discussion on the motion? Hearing none, then all in favor? Aye.
Aye.
All opposed? The ayes have it, the motion carries. At this point, I'd like to open the floor out for comments from my colleagues.
Oh, I'd like to, just put an asterisk possibly after that resolution that should read for the full version of accomplishments that, Mr. Rocha brought to the system itself, should be looked at and greatly appreciated. Most, if not all of you, have been in and around Cook County and the community for quite a long time. And so you've seen the history and the evolution of a lot of things. And I don't know, certainly in my lifetime and many of ours, there was no period that was as stressful as and demanding and challenging and potentially could have been a lot worse than it was during the pandemic itself. So it's fortuitous that Mr. Rocha arrived in front of that in that period, and I think put the system itself on a very excellent path for management and, more importantly, recovery from those dark times. So while we are still having some lingering challenges, we're in a great position because of his personal effort and his commitment. And the big thing for me is your passion for making things right and better for all of your constituencies and communities that you serve. So I'd like to thank you very much for the time that we've had you at the leadership.
Israel, you and I have had numerous conversations about the operation of the Cook County Health and Hospital System over the years. And I'm grateful, and I know, speaking on behalf of the citizens of Cook County in the President's office, we're absolutely grateful for your leadership, your steadfastness, your willingness to pull and place this institution on your back, and at times just push it forward. So we're grateful for your willingness to take that risk, at times, because some of this was risky, but most importantly, it was necessary to ensure the long-term viability of this organization and to put in place certain structures, constructs, if you will, that as you exit can still be built upon. These are building blocks without prejudicing any future CEOs. We have a construct there in which we can build upon that is not necessary to reinvent anything going forward, from quality, to productivity, indices, and manpower monitoring activities. I mean, we look at HR, we look at supply chain and productivity, and what Pam Cassara and her team are doing in RevCycle. I mean, it's just really remarkable in such a short period of time, what those three key entities, those critical success factors, HR, supply chain, and finance, have done under your leadership, that we can continue to build upon that, because, Neil, there's a roadmap. There's a pathway for this organization to follow. And I think part of my responsibility as a board member is to ensure that we continue to provide the support for those initiatives that you stood up over the last 3 years. I think that's what I'm most grateful for, that there's that pathway, Neil, that this organization, I trust, will not deviate from Israel. And if we do, you can write an op-ed. But seriously, we're grateful, And, you know, God bless you and your family, and we wish you nothing but the very best going forward. Thank you.
Thank you. Anyone else?
Yeah,
Yes.
as Chair Israel, I'll say, I appreciate the service you've given to this organization and the partnership you've had with all of the directors here on the board, right? As my colleagues have highlighted, it has been difficult and challenging times. We recognize the role of CEO is always challenging. And as they say, it's lonely at the top. And that said, you've borne that burden, but you've been a great partner. And you've been an advocate for the community, and we really appreciate it. And we wish you all the best, as well as your family. Thank you.
I would just like to wish him well. I'm the new kid on the block, but, I wish you well.
Yeah, I want to say while you're leaving us in a better place, and we're grateful for that, and I wish you well moving forward.
I'll just say, Israel, it's hard to believe it's only been 3 years. You've done so much in a short period of time. Now you can go to Kaiser and relax. And I'll give the last word to Israel.
You know, change is always bittersweet, so today definitely here with a lot of mixed emotions, but I do want to, you know, express to the chairman, to all of the board members, thank you for your steadfast support. That change is hard, but it's a partnership. You can have great ideas, but if you don't have the support, they won't move forward. And also, you know, want to thank the amazing Cook County Health team that they really did make it happen. And so, you know, again, if you don't have the team with you, they don't happen either. And I was truly honored to, I also want to thank the board for giving me this opportunity. It has changed my life in so many ways, and I am a different person for having had this opportunity to work with the Cook County Health team, to work with each and every one of you. I am better for it, and it will forever change me and be a part of who I am. And I thank the board for taking a chance on me when you all selected me for this position. So thank you so much for that opportunity and for bringing me to Chicago and letting me have what has been the biggest and most monumental part of my career to date. And so thank you for giving me the opportunity. And truly just thank you to the Cook County Health team. They are some of the most brightest minds that I have ever worked with, and some of the most talented people in healthcare today. And I know that wherever Cook County Health is going to go in the future, they're going to go in an amazing fashion, because I have every confidence that the Cook County Health team is going to make it's going to make its future even brighter than its current past. And so know that they're going to do amazing work going forward. And so while it's always difficult for change and it has mixed emotions, just want to thank everyone for the opportunity. And I look forward to seeing the amazing things Cook County is going to accomplish in the days ahead. And as I've always said, no matter what happens, I'm Cook County and Cook County Health forever. So it's just extending the family. All you have to do is call me at any point, and no matter where I go, once part of Cook County Health, you are always part of Cook County Health. And just so excited to have been a small portion of this organization's rich legacy in helping to change lives for so many people over the last 200 years. And most importantly, setting the path for the future 200 years to come. The Cook County Health will continue to innovate. So thank you all so much for the opportunity, for the trust, and for a truly remarkable and extraordinary experience and the opportunity to work with so many amazing people.
Thank you, Israel. Okay, we will move to item 4B on the agenda, minutes of the Human Resources Committee meeting dated August 17th, 2023. These were approved by the board at the August meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Okay, hearing none, I'd like to entertain a motion to accept item 4B, the August 17th committee meeting minutes. So moved. Thank you.
Second.
Thank you. A little trepidation there.
Typically, others like to play those roles, so I didn't realize I needed to step out.
Yeah, okay, so we've got a first and a second. Any further discussion on the motion? Hearing none, then all in favor? Aye. All opposed? Okay, motion carries. So we will be going into closed session, and before we do that, I'll defer to Chair Taylor, who has a brief update on the search activities for the permanent CEO.
Thank you very much, Director Garza. Pursuant to the enabling ordinance, the system board shall conduct a nationwide search for a CEO with the goal of no later than 180 days from the date the position of the CEO becomes vacant. Therefore, in order to be nimble and responsive to the enabling ordinance, a special committee will be created for the recruitment of a candidate for the position of permanent CEO. Upon approval of the appointment of the permanent CEO by both the CCH board and the county board, the special committee's existence will no longer be necessary, and it will dissolve at that time. The members of the special committee are Director Garza as chair, Director Deere, Director Ryder, Director Story, Board Chair Taylor, and Hill Hammock, non-director member and non-voting advisory role. Because Director Garza is the chair of the Human Resources Committee, was natural fit for him to chair the special committee given the subject matter. The other members were selected either based on their committee assignments or on the nature of the appointments to this board. For example, Director Deere, who serves as the chair of the county's Board of Health and Hospital Committee. This composition also includes a representation of all standing committees. Thank you.
Thank you, Mr. Chair. The committee will now be going into closed closed meeting. No action will be taken after the adjournment of the closed meeting. So I'm going to ask for a motion to go into closed meeting pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120/2, C1, 2, 11, and 17. Have a motion, please.
So moved.
Second. Okay, we'll need to take a roll call vote, Madam Secretary.
Roll call vote on the motion to go into closed session. Aye or nay, Director Curry?
Aye.
Did you say aye? Aye?
Aye.
Yes.
Just an aye.
Director Robinson?
Aye.
Director Sorrell is absent. Chair Garza?
Aye.
You have 3 yeas and 1 absent.
Okay, thank you.
Yes, it ayes have it.
Oh, sorry, the ayes have it. If that wasn't
Motion
obvious.
So the board will now be going into closed session.
We'll now be going into closed session.
And those who will be joining remotely can go to the invitation that you should have. I'll resend it if you need it.
Thank you very much.